Today we are talking for the medical students the most common operation in the cardiac surgery, that is coronary artery bypass surgery. So it is a operation which is done most commonly, and it is done for the ischemic heart disease. So ischemic heart disease, if you see, the heart is having three blood vessels. There is one large blood vessel which goes and encircles the apex here, and this is known as left interior descending artery. So it arises from the left coronary, as a left coronary artery from the aorta, and goes down and supplies the major portion of the interior wall of the left ventricle and interior 2/3 of the septum. It's a major artery, and another branch out of this thing comes like this and encircles the heart like this. So this is known as a left circumflex artery, and this is known as a LAD artery. So all the branches which come like this from here are diagonals. So diagonal 1, diagonal 2, diagonal 3, and the vessels which come out of this thing is known as obtuse marginal. Obtuse marginal 1, obtuse marginal 2, obtuse marginal 3. So this is the left sided vessel of the heart which supplies the major portion of the heart, and it comes from the aorta here, and a short segment is on the back of the aorta known as a left main. Out of that left main, two branches come. One goes anteriorly known as LAD, and one goes and encircles the heart from back and comes like this known as obtuse marginal. So this is the left sided system, and then a vessel comes from the right side known as a right coronary artery. So this right coronary artery is an artery which is coming from the right aortic sinus, goes down and divides into two portions, giving rise to posterior descending artery and posterior left ventricular branch. So by this criteria, there are three vessels, 1, 2 and 3. So heart is supplied by the three vessels, and all the three vessels are very important for the proper working of the heart. So any disease, any atherosclerosis, any stenosis, any block in 1, 2 or 3 vessels give rise to a heart attack, and that is known as either a single vessel disease, either a double vessel disease or a triple vessel disease. Usually the blocks happen in the proximal portions of the vessel, and accordingly there are so many areas which are deprived of the blood vessel, which is deprived of the blood because of the blocks in these vessels proximally at multiple levels. So the idea of these blocks are done by an investigation known as the coronary angiogram, in which a radiopaque dye is injected right into the coronary arteries, and various images are taken in a catheterization lab, and we have an idea of what arteries are blocked at what level. So we plan an operation according to that, and that operation of bypassing these vessels is known as coronary artery bypass operation, which can be done either in a beating heart fashion or in a arrested situation known as CABG on pump. So the CABG is a coronary artery bypass grafting. Either it is done by arresting the heart with the help of a heart-lung machine known as on-pump CABG, and another variety of CABG is there in which the heart is beating only without the help of heart-lung machine. We do it known as beating heart. So whatever is the technique of doing the bypass operation, commonly known as a bypass operation, but it is a coronary artery bypass grafting. There are various conduits in the human body God has given, which are used to bypass these vessels. These conduits most commonly, suppose if this is the sternum, if the sternum is like this, manubrium sternum, main sternal body, and the Ziphy sternum. So if the thorax is, these are the various ribs. So there are two vessels which come and descend here down, branches of subclavian. These are known as internal mammary arteries. On the left side it is known as left internal thoracic artery or left internal mammary artery. Right side it is known as right side internal mammary artery or right side internal thoracic artery. Lima, Rima or Lita, Rita, whatever. Fine. So these are the two vessels in which we use to do the various bypasses, and the potency of the bypass is very, very long term. Apart from that, there are two radial arteries. If the hand configuration is like this, and this is the elbow, and this is the radius and ulna. So there may be a radial artery on one side, radial artery, and another radial artery. So radial artery is another second conduit of choice, which is used by many surgeons apart from Lima and Rima. And apart from that, two long saphenous veins starting right from the foot going up to the groin are there, long saphenous veins which are used to bypass the various segments. So the combination of the internal mammary artery, radial arteries, and the leg saphenous veins, and sometimes the gastroepiploic artery, which is taken from the side of the stomach. These are the vessels which are used to bypass various blocks of the heart in the bypass surgery. So the most common configuration of the bypass is, suppose this is a human heart, and so we have to bypass this anterior descending artery and the obtuse marginal artery and the right side vessel, and this is the aorta. So the most common way of doing it is to anastomose the left interior descending artery to the LAD, that is known as Lima to LAD, and we use two saphenous veins usually in majority of the cases to bypass the acute marginal and the right side vessel. And the proximal end of these are the distal portions where the anastomosis is done with the reverse segment of the saphenous vein, and the proximal end of the saphenous vein is attached proximally to the aorta like this. So this is the most common heart operation, a bypass operation in which a internal mammary artery is used to bypass left anterior descending artery, and two saphenous veins are used to bypass right side and the circumflex vessel with two proximal anastomosis. This is the most common configuration of doing the coronary artery bypass operation, whether it is done in a beating heart fashion or a arrested heart, and this is the most common operation done, and it's a well studied operation, and the long term results with these operations are quite good. Apart from that, a lot of medicines are there which is to be taken after the surgery is over, and the various lifestyle modifications are there. If done proper in a proper way, the longevity of a patient after a coronary artery bypass depends upon 15 to 20 years. Suppose if you are doing a operation in a 50 year of life because of this thing, so if you do a good operation and medicines patient take regularly and lifestyle modification, he lives a normal life of 70 to 80 years. That is the aim of the operation. This is the best operation designed in cardiac surgery to the mankind, and the results are quite phenomenal. So that's all about a quick brief of coronary artery bypass surgery, a most common operation done in the operation theatres. Thank you very much.